Well, thank you for joining us for our benefit open enrollment review. Open enrollment, just to remind everybody who might not be aware, is the one time per year that you can make changes to your benefit elections or the family members that you cover. And we wanted to just make sure that everyone has a full understanding of the benefit options available to you in the open enrollment process in general. So today we're joined by Paul Worth, Executive Vice President and Senior Consultant for Employee Health and Benefits from Marsh & McLennan Agency, who is our broker. And Paul's going to just walk us through our 2024 open enrollment guide, and we'll also cover at the end what steps you need to take to complete the open enrollment process. And before we get started, I did just want to mention we do really appreciate everyone who responded to our open enrollment survey last year. We got a lot of great feedback, and we tried to incorporate many of those questions into this year's review because we want to continue making the process better and better. So this year, we do plan on doing a similar survey after open enrollment wraps up. So we would really appreciate, again, anybody who responds and gives feedback about the process so we can continue to improve it. But for now, Paul, thanks for joining us today, and I'll turn it over to you to get started talking about our benefit plans.
Thank you, Joyce. Let's start with our medical insurance. As has been the case, ESSA offers two medical programs for you to choose from. A high deductible health plan, often called an HDHP, which you can associate with an HSA or health savings account with. And then we have our traditional plan. So you'll hear me talking about both of those. As a reminder, we do have a program in place where if you visit an ESSA health provider, you do get additional benefits, which we'll explain to you in a moment. As you'll see on the screen, and by the way, this does not need to be memorized. All this information is available to you, but this is simply an overview. As you'll see on the screen, you have the cost, which is 2 times per month. And as a reminder, there is a tobacco surcharge of $50 per month. And there is also a working spouse contribution, which is added to those contributions at the top of the page. So if your spouse has access to coverage through his or her employer, of course they could be on our plan, but you will pay an additional $50 twice per month. It is incredibly important to stay in the network. The network is not changing. It remains Aetna. And again, as I will mention again in a moment, we do have additional benefits if you're utilizing the ESSA network provider list. Our network includes physicians, facilities like urgent care, emergency room, nurse practitioners, everything like that. Again, staying in the network, the physicians and providers in the network agree to substantial discounts off of their fee for service. Okay. Here is the meat and potatoes of the medical program. You'll see 2 columns, HDHP, which again stands for high deductible health plan, and then our traditional plan. What we are looking at here is our in-network benefits. Both plans include out-of-network benefits, but it's imperative to stay in the network to receive the highest level of benefits. As you will see, both plans have a deductible. The HDHP plan has a $3,200 individual deductible, caps the family at $6,400. The traditional plan has a $1,000 deductible or $2,000 deductible for family. I want to pause right there because this is where the big difference is between these two plans. With the high deductible health plan, you must satisfy the deductible first before benefits begin. The exception is preventive care. Preventative care is covered at 100% on both plans. If it's not preventative care and you enroll in the high deductible health plan, you must first meet your deductible. Whereas if you look at the traditional plan and you go halfway down the screen, you'll see $25, $50, you'll see $200 for emergency room. Those are copays. Those copays are in lieu of the deductible. So if you go to the primary care physician, or if you go to your specialist, or if you go to the emergency room, you do not have that deductible, you have a copay. Whereas on the high deductible plan, you don't have a copay, you have to meet your deductible first. And if you're in the network like we're showing you, you'll pay the reduced negotiated fee that the provider charges that will be subject to your deductible, and then you will get a bill to pay that. Okay, that is the big difference between those two plans. Now, once your deductible is met, then we have coinsurance. So if I have a large claim and I'm in the HDHP plan and I'm an individual, I'll first pay my $3,200, but I'm not done. If my claim is more expensive or higher than the 3,200, then I still have to pay 20% of the remaining balance of that claim. The out-of-pocket maximum is awfully important because once my deductible and my 20% and the HDHP plan adds up to $6,000, as long as I stay in the network for the rest of the calendar year, my plan pays 100%. That is truly an out-of-pocket maximum, okay? The traditional health plan has a 20% coinsurance layer on top of the deductible as well. Once my deductible and my 20% and any applicable copays gets to $5,000 for an individual or $10,000 for a family, then for the remainder of the year, as long as I stay in the network, the plan will pay 100%. So that is the big difference between the two plans. And as I'll talk about in a moment, if you enroll in the high deductible health plan, you can then open up a health savings account or an HSA to put money into pre-tax, whereas you cannot do that if you enroll in the traditional plan. Both plans have prescription coverage. If you look halfway down the page, you'll see where, again, that high deductible health plan, you have to satisfy that deductible first. And by the way, that is an all-inclusive deductible, right? So it's not like you have a hospitalization deductible and a separate prescription deductible. This is a calendar year deductible for both medical and prescriptions. Once you would satisfy that deductible, then you have copays. And you'll see that the copays for the HDHP plan are $10. For tier 1, which is generic drugs that you'll see on the top. Your preferred copay is $45. I often call it tier 2, but your preferred copay is $45 after the deductible, and those are your preferred brand names. And if you use a non-preferred drug, then you'll have a $70 copay after the deductible with the high deductible health plan. The traditional plan, remember, you do not have a deductible to satisfy before prescriptions are covered. You simply have a $10 copay for generic, $50 copay for preferred, and $75 copay for non-preferred. Now, those copays are for a 30-day supply at the pharmacy. If you're on a prescription for something maintenance related, maybe high cholesterol or high blood pressure, I would encourage you all to familiarize yourself with the mail order, because you do get a 90-day supply and you can save some money via a lower copay. Okay, there is also in-network mail order specialty drugs, 30-day supply at the benefits shown on the screen. One point I want to make about prescriptions is that when you get a prescription filled by your doctor and sent to the pharmacy, that doctor has to either assign that as dispense as written or substitutions available. If the doctor prescribes your drug and sends it to the pharmacy as DAW or dispense as written, that pharmacy doesn't have any choice but to give you the drug that is indicated on that prescription. And it might be a non-preferred drug when there is a generic available. So please make sure that if you are able to take the generic, that the doctor is signing your prescription as substitutions available. That way the pharmacy can default down to the $10 or the cheaper drug, if you will, without having to call the doctor and get authorization for that. Okay? So that is your medical and your prescription program. We are adding 3 programs to assist with your medical needs. The first is an oncology program. So if you or somebody covered in your family is unfortunately diagnosed with cancer, we are or we have added an oncology program that can assist you with care management. There are cancer support centers, patient support. This is a terrific program in a time of need. You shouldn't be worried about your benefit program. You need to be worried about your health, and this program can certainly help you do that. We are also adding a diabetes program, similar to the oncology program. If you are diagnosed with diabetes, the Optimize My Care can assist you with managing your diabetes. And then finally, at the bottom of the screen, the Bridge program is a financial assistance program there to provide assistance with some of those high-cost specialty medications in the event that you need to be on one of those. The contact information and everything is on the screen, and this will be available to you throughout the year. Moving on to dental insurance. Again, dental insurance is not changing. It remains with Delta Dental. There are two plans, option 1 and option 2. And I'm going to explain the differences because they are interesting programs. As you will see, option 1, I want to point out, go down to the bottom of the illustration. You'll see where option 1 covers orthodontia. Depending on what dentist you see, it's going to be covered at 50% or 20%, and there's a lifetime maximum for orthodontia of $1,000 and $700 depending on the dentist. Okay, you'll see that option 2, it does not cover orthodontia. What's interesting about these programs is if I go back up and show you the cost, the program that covers orthodontia is actually cheaper than the program that doesn't. And you might be saying to yourself, well, how could that be? If we're adding orthodontia, shouldn't that increase the cost of the program? Well, it's all about the details, and it's all about how we're paying dentists that are in the Delta Dental Premier program and out of network in option 1. Option 1, with your Delta Dental PPO dentists, those dentists agree to a reduced fee for their service, and sometimes those reductions can be significant. The way option 1 works is that if you do not go to a Delta Dental PPO dentist, say you go to a Delta Dental Premier dentist, or you go out of network, those dentists are going to be paid at the in-network PPO negotiated fee. So those premier dentists and out-of-network dentists are not going to get the usual and customary charge amount for their fee. They are going to only be paid at the in-network PPO negotiated fee level. So unless you're in option 1 going to a PPO dentist, you will most likely be balance billed the difference between what that premier dentist wants to charge or that out-of-network dentist wants to charge and what the negotiated in-network PPO fee is. So be careful about that. So with option 2, we have PPO dentist and we have Delta Dental Premier dentist, and then we have out-of-network. The difference between option 2 and option 1 is that the Dental Premier dentists are allowed to charge usual and customary rates, and the benefits will be paid on that higher allowable charge. Remember option 1, they're not allowed to do that. They're only going to be allowed to charge the PPO negotiated fee. So with option 2, those premier dentists are going to get to charge a higher rate, thus lowering the opportunity to be balance billed. And that is the big difference between option 1 and option 2. If you also think about it like this, option 1's maximum benefits, the $700, if you will, for the premier benefit or for the premier dentist, that $700 annual maximum, it will actually be stretched further because what they're allowing that dentist to charge is less. So it's very important to choose a program based on your dentist and what network that dentist participates in. Let's move on to vision. Vision is not changing. It is still through iMed. The cost on the screen remain the same. As with medical insurance, as with dental insurance, so too with eye or vision insurance, it is imperative to find a network provider. Because in the network with your vision program, you have a $10 eye exam. And let me point out that vision insurance is designed to cover vision. the exam with a vision program, a vision insurance program, is to tell how well or how poorly your vision is. If your eyesight, or if your eyes get hurt as an injury, or if it's pink eye, or if it's an illness or an injury of the eye, that's medical insurance. Okay, so vision insurance is strictly to see how well or how poorly you can see. So you get an exam for $10. Based on that exam, if it's determined you need glasses or contact lenses, by staying in the network, you'll pay nothing for frames up to an allowance of $120. Um, if your frames cost more than $120, then you do get a discount off of the balance. You may also get contact lenses for a no copay. And then you'll see in the middle of the page the illustration based on your lens needs. So single, bifocal, trifocal, lenticular, you can get those lenses for a $10 copay. But if you start doing things more progressive to your lenses, then you will pay more according to the copays that you see on your screen. And then lens options, you'll see the reflective coatings, and that will cost you additional as well.
And just to add one note, in case anybody's confused and heard it the way I did, just to make sure everybody understands, you can either get glasses or contacts every year. You can't get both in the same year.
Thanks for pointing that out. That is, yep, you're right. In lieu of glasses, you may get contacts, but you're not getting both, everybody. So let's move away from our insurance programs and talk about this health savings account that I mentioned earlier on when we were talking medical insurance. You'll remember that we talked about a high deductible health plan and we talked about a traditional plan. If you are enrolled in an HDHP plan, you can now open up an HSA, or a health savings account. Think of a health savings account as a checking account that you are funding with pre-tax dollars. Those dollars can grow. You never lose those dollars. They stay with you until you spend them. If you get to Medicare eligibility, you can use them during your Medicare years. They are truly your dollars to spend on eligible expenses. They go into your health savings account pre-tax. If you spend those dollars on eligible expenses, as you'll see in that middle paragraph, things for prescriptions, contact lenses, anything dealing with your dental, all those things. If you're using them for a qualified expense, then you're not taxed when it comes out of your HSA. And as your funds grow, any interest that you would accrue on your balance, that grows pre-tax as well. So it really is a pre-tax program designed for you to spend on your medical related issues, just as long as you are only insured in a high deductible health plan. If you look under the eligibility in that light green, that's where I point out where if you, or if you're covering a spouse and maybe they're covered elsewhere under a non-high deductible health plan, there may be limits to what you can contribute to your HSA. So for 2024, the IRS allows us to put $4,150 into our HSA account if we're covering just ourselves. If we're covering our family and they're not covered anywhere else under a non-high deductible health plan, the max we can put in is $8,300. If we're 55 years or older, we can add $1,000 to those amounts. And by the way, perhaps one of the neatest things is ESSA contributes $50 a month towards your HSA account. That $50 will be included in those maximums that are to the left of that. It's not in addition to that. The way health savings account works as far as depositing money, you could start, you could stop. You can really be creative with how you fund your HSA. If you don't have dollars in your HSA during a particular year, but you have an expense during that same year, you can always pay yourself back once you do have HSA dollars into your account. It really is pretty flexible. Okay, but the key is you have to be covered under the high deductible health plan in order to be contributing to your HSA account. If in the future you decide that the high deductible health plan is not for you and you want to say move to the traditional plan, that's no problem. You just won't be able to contribute any more to the health savings account. You don't lose the money. You can still spend the money. If it's spent appropriately on eligible expenses, it's still tax-free. You just can't put any more in unless you were to enroll again in that HDHP plan. Okay, a different way to save taxes, but similar, is this flexible spending account. So a lot of times participants in the traditional plan who cannot participate in the health savings account can participate in the flex plan. The purpose of the flex plan is very similar to the HSA in that you're saving taxes by putting dollars into an account that you can use for general health related purposes, whether it's deductibles, copays, dental work, glasses, things like that, right? In fact, the list of eligible expenses to use your flex dollars is the same eligible list that you can use your HSA dollars. Okay, so the eligibility list, which you could find on the IRS website, is the same for both the HSA and the FSA. Okay, so what's the difference? Well, the FSA, remember with the HSA, I said, as long as those dollars are put into your health savings account and you don't spend them, they're yours. They don't go anywhere. The flex plan is an annual plan. You are making an election to go into your flex plan for the purposes of spending in that plan year. Because if you don't use your medical spending account flex dollars in that plan year, you lose them, you forfeit them. Okay. That's why under your flex plan, it's very important to make an educated election because those dollars need to be spent in that plan year. Now, the election or the FSA, the medical spending account that I'm referring to, or the healthcare, we're calling it the healthcare spending account that I'm referring to, those dollars can be spent on you. They could be spent on your spouse. They could be spent on your children. Your spouse and children don't necessarily have to be covered under the health plan or the dental plan for these dollars to be spent on their out-of-pocket exposure. Okay, but again, the key is choose wisely, elect wisely. I'd rather see you spend all of your FSA healthcare dollars before the end of the year than trying to scramble around figuring out a way to spend them. Now, there is a separate account on your flex spending program called dependent care. So if you have a child in daycare, you could set aside up to $5,000 to pay for those daycare related expenses or the dependent care related expenses. The big difference between healthcare and dependent care, other than what you're spending the money on or spending the money for, is that with the healthcare FSA, you have access to your entire election amount the first day of the plan year, even though that election amount is going to be divided evenly and taken out over your paycheck over the course of 12 months. The dependent care works differently. You can only get out of dependent care what you've deposited. Okay, so if we're 2 months into the year, you have $600 in your dependent care, and you have a $800 bill that you want to use your dependent care account for, you can only get $600 out. The $200 will come later once you've had deposited into your dependent care account. Okay, back to some insurance programs offered to you through ESSA. Life and accidental death and dismemberment coverage is offered to each of you. It's insured through Unum. It is what it is. So if you are to die, the life insurance amount will pay. If the death is a result of an accident, you also get accidental death benefit. There is dismemberment included in the accidental death and dismemberment. So if you wish to purchase more life insurance, you may do so through ESSA's voluntary life insurance program. It is in increments of $10,000, and the maximum would be 5 times your annual earnings or $500,000. You'll see on the bottom of the screen, it is an age band, 5-year age bands, and the rates that you see are per $1,000 of coverage. If you are a new employee, there is a guaranteed issue amount that you would not have to satisfy evidence of insurability. If you are no longer a new employee, you may purchase this life insurance. Just know that you're going to have to go through evidence of insurability, and you're going to have to pass underwriting. You may also purchase voluntary life insurance on your spouse and children if you're purchasing it on yourself. ESSA offers long-term disability, which is essentially paycheck insurance. If you are injured or you become ill and you no longer can work, long-term disability begins after being out of work for 90 calendar days. So on that 91st day of being out on disability, our program through Unum will pay 66 2/3 of your monthly salary to $10,000 of a month benefit maximum. Now, long-term disability by its name will pay for a long time. It'll pay until you're either able to return to work, or if you're unable to return to work and you're never coming back to work, it'll pay until you reach your Social Security normal retirement age. To bridge the gap between being disabled and long-term disability kicking in, we do offer a voluntary short-term disability program that begins after 7 days of being out of work. This program pays a weekly benefit equal to 60% of your pre-disability earnings to a weekly benefit maximum of $2,000. You'll see on the screen that it pays up to 12 weeks. Well, short-term disability ends where long-term disability begins. They dovetail together. Just a note that short-term disability does not pay a benefit on work-related disabilities. That would be workers' comp. However, long-term disability does. We do offer additional voluntary benefits, voluntary critical illness and voluntary accident, as well as voluntary legal and identity and fraud protection. Critical illness, it is what it sounds like. So there is a list of diagnoses that if you unfortunately are diagnosed with something that is covered, you will receive a benefit depending on the election that you choose. So critical illness comes with 2 benefit options, $15,000 or $30,000, and it is in age bands of 5 years. Okay, you could purchase it on yourself, your spouse, and children. And this is as good as our medical insurance programs are. Critical illness is really designed to pay for those things that might not be covered by medical insurance. So if there's travel related expenses because you want to go to a hospital out of the area or anything like that, critical illness, assuming that it's covered, right? It's a covered diagnosis, can certainly help fill those voids where maybe your health insurance doesn't cover. Same with accident. So critical illness pays a benefit if you get ill or if you get sick. Accident only pays if there's an accident, right? A great example of this is if you have a family, seems like kids are always getting hurt playing sports. Certainly an accident policy can supplement some of those costs related with those injuries. We do offer 3 programs, a low plan, a medium, and a high plan. And obviously the amount of benefit paid per accident will increase from low to high. The legal plan offers assistance with money matters, home and real estate, estate planning, everything that you see on the screen. At $9.88, you get access to legal counsel for all the related issues that you see on the screen. Same with identity and fraud protection. So keep hearing over and over about how people's identity is stolen and the nightmare that is associated with that. Well, certainly the identity and fraud protection program can assist. Um, the cost is employee only and family. Did you know we also offer an EAP program, an employee assistance program through personal assistance services? I tell you what, personally speaking, since COVID, life has changed, and the EAP program can assist not only you but your children, family members. It is extremely confidential. ESSA will never know that you reach out to PAS. So whatever life throws you, please know that you have assistance through the PAS Employee Assistance Program. We also offer insurance for our furry family members through MetLife. Okay. We also offer our Wellness Rewards Program. So please familiarize yourself with that. Make sure you're taking advantage of all the rewards that ESSA offers for your wellness initiatives.
Yeah, our wellness team does a really great job of putting together a variety of programs for all of us because at ESSA Health, that's the whole goal. We want you well. So it's awesome to have those programs supporting us and our families. Thank you, Paul, for explaining the benefits to us and taking some time to do that. And I wanted to remind everyone that you have any additional questions or more specific questions, or just wanted someone to talk to you about any of our benefits one-on-one. We have our benefit counselors available through our Enroll Contact Center that can do that. And that number is going to be listed on page 6 of your Open Enrollment Guide. For the 2024 benefit information, we do ask that you wait until November 1st to begin calling so that the counselors have some time to receive training on any new benefit information. So the way it works is we mail out the guides and then we give everyone some time before November 1st to begin looking at the information and jotting down your questions. And then once November 1st hits, the enroll counselors are available from 8 a.m. to 5 p.m. Central Time, Monday through Friday. And keep in mind that this is a busy time of year, so if you call at a time when all the counselors happen to be talking to other people, you'll always have an opportunity to leave a message for them to call you back. And if there's any specifics you can leave in your message as far as when a good time is to call you back, I'm sure that's always helpful to the counselors as well. I also wanted to take a few minutes to run through the actions that all of our benefit eligible employees need to take. Here at ESSA Health, we have what's known as an active enrollment process, which means your elections don't roll over from year to year. So it's really important to follow the instructions to go online or call the Enroll Contact Center between November 1st and 15th to make your elections, because if you don't, you won't have benefits after December 31st. Even if you're declining benefits, we do need you to still go online or call too so that we have that confirmed. And we do try to make the process as easy as possible. So if you just want to keep the elections you have and you go into bswift, there are going to be buttons for each benefit that say keep my selections. So you can just keep those selections in place by using that keep my selection buttons, and then that'll make it a really smooth process for you. And it really is a good thing that everyone is reviewing their benefit elections each year so you know what benefits you have, and also so that you can consider all the options available to you, whether it be through ESSA Health or a spouse's plan. Things do change from year to year, so it's important to check in each year and make sure your selections still make sense for you. Also to make sure you remember what benefits you sign up for, because you don't want to sign up for a benefit and be paying for it, like maybe accident insurance, and then mid-year, if you have something happen like you tear your ACL, you want to know you have that benefit. You want to be paying for something and then forget to take advantage of that benefit when it comes time to use it. So again, just take a look at page 6 for all of those instructions for completing the open enrollment process and for uploading your dependent eligibility documentation. Then that also again has the number for our Enroll Contact Center, the 855-639-9105, if you have any questions or you would just prefer to make your elections over the phone with a benefit counselor. And then just a reminder of the timeframes. You do need to complete those instructions to make your elections and upload any of those dependent documentations between November 1st and 15th, and make especially sure that you review your confirmation statement and print or save a copy of that. Because once November 15th passes, you won't be able to make any changes to what appears on that confirmation statement unless you experience a qualifying life event such as marriage, divorce, or having a baby. Generally, any benefits that you elect to participate in are going to take effect on January 1st. So you're also going to want to take a copy of that confirmation statement you saved and check it against your January 12th pay statement. And if you see any differences between the benefits you elected and then what's showing up on your paycheck, make sure to contact myworkplacehelp@usahealth.com before January 19th so that we can get that fixed. And that email, if you forget it, is also going to be listed on page 4 of your open enrollment guide as well. Now, that doesn't mean you can change what you elected at that point. It's just if your paycheck doesn't match what your confirmation statement shows and your deductions need to be corrected, that's what we're talking about there. Okay. So then if you're going to be enrolling dependents in the medical, dental, or vision plans, please take a look at page 5 of your enrollment guide. And if you're going to be adding someone who's not currently covered under one of those plans, medical, dental, or vision, then you're going to need to make sure that the appropriate documentation is uploaded into your employee file in bswift. So that documentation is going to be listed here at the bottom of page 5. So for example, if you're enrolling a spouse, they're not covered under the medical, dental, or vision plan as of November 1st, you'll need to make sure that in your employee file in bswift, there is a copy of your marriage license and the most recently filed federal tax return. You only have to upload that first page typically. So that's what's going to need to be uploaded into bswift. Up here in this gray box on page 5, we also let you know how to check and see if your dependents are verified or unverified. So that'll apply November 1st and after. If you go into the bswift beginning November 1st, look up your family members, it'll tell you whether they're verified or unverified. And if you see that somebody's unverified and you plan on enrolling them in the medical, dental, or vision plan, you'll know that that's a person that you're going to need to make sure that that dependent documentation is uploaded into your employee file in bswift. When you go to do that, you'll just follow the bottom portion of this box here to go into your employee profile and then your employee file, and that's going to show you all the documents currently in there, and then it'll allow you to upload new documents in there as well. If you go into your employee file and you see that you had a child that was enrolled in the past, but they're currently not enrolled in the medical, dental, or vision plan, and you want to enroll them for 2024, you do need to make sure that a copy of the needed documentation is in that employee file. But if you see like, oh, I already have the birth certificate uploaded, you don't need to upload a duplicate copy. We'll see that and that'll be fine. It is important when you're looking at your spouse to make sure that the most recent copy of your federal tax return is in there if they are unverified. So if you go in and there's already a copy of your marriage license to your current spouse in there, again, you don't have to upload a duplicate copy. But if you go in and there's a federal tax return from 2019, that means that you will need to upload a copy of your more recent federal tax return, most likely your 2022 first page of your federal tax return. And then one other reminder about the dependent eligibility documentation. If you do have a dependent that you need to provide documentation for, once November 15th hits, within a couple of days of that, we will send out one email reminder to let you know that there's documentation that's missing that needs to be uploaded in order for that dependent to be covered. That's not a general email going out company-wide. That's specific to you. So make sure not to ignore it if you get an email like that. Make sure to take the actions listed. Otherwise, that dependent or any dependents listed in that email won't be added to your coverage, and you won't have another opportunity to add them until open enrollment for 2025 unless you experience a qualifying life event. All right, and while I have everybody, I just wanted to also mention our Well Connected app. So if you haven't gotten on that yet, really encourage you to do that because it also gives you a great way to get connected to all of your benefit information wherever you are 24/7. You don't have to be in the office. And thought I'd just show you quickly what that looks like in case you haven't had a chance to sign up. If you go in, your screen is going to look something like this, whether you use the app or the desktop version. As you can see, it's got a lot of great resources from benefits to being able to quickly connect to my workplace where you can view your paycheck information. It's got information about past employee wellness, different employee resources out there. But also when it comes to open enrollment time, if you go in the benefits section, there's a link for Get Help with Benefits, and that is going to connect you right to the enrollment and bswift help. So it'll have all the contact information for the Enroll Contact Center. And if you're accessing this through the app, it's really convenient that you can just click to call the enroll counselors right from your phone. So that makes it super easy to get in touch with them whenever you have questions. All right, and then also back to the benefits section, we did get a question during our feedback survey from last year's open enrollment about how you can view a copy of your benefit confirmation statement after the open enrollment process has closed out, or maybe at any point during the year. So that is also out there under the benefit section, if you just go to benefits and then go to manage my benefits, it's really nice. It'll give you the link to connect to bswift and log in to manage your benefits there. But it also has a guide to bswift out there. So it gives you a lot of commonly used tasks that you can do in bswift and step-by-step instructions for each of those. And one of those is print a benefit confirmation statement. So if you pull that up, it will walk you through how to log on to bswift and then how to access that benefit confirmation statement at any point during the year. And one cool thing in bswift is it has this date box here. So just when you're pulling up your confirmation statement, make sure to reference the date because it's going to be showing your benefits as of that date. So you can change it to today's date if you want to see your benefits in effect today. Once you've done your open enrollment elections and have those finalized, if you want to pull those up again, you can just change that date to somewhere in the future, like January 1st, 2024, and then that will show you your benefits effective that date or, any date in the future or past. So that's a really cool feature of bswift. Okay, so if you haven't had a chance to get on that well-connected app or desktop portal and you want to do that, there is a QR code right on your screen there. You can just scan that with your phone. It'll walk you through the process of setting up your account and then downloading the app to your phone there. Just before we go, wanted to mention a few things, questions that came up from our feedback survey from last year. And again, we thank everybody who replied to that. We passed along that feedback to our leadership team. We also incorporated a lot of the questions and things into the planning for open enrollment this year, just to hopefully make the process better and better for everyone. So thank you. We had a lot of great things mentioned in that survey. One question that came up was if we could explain the differences between our two dental plan options. So if you didn't get a chance to hear that piece of the presentation yet, just back it up a little bit. We've got timestamps included, so you can go back to the dental plan section where Paul was explaining that, and he did a really good job of walking us through the differences between the two dental plan options and what to consider when you're choosing which dental plan to enroll in. So definitely check that out. Also, we had some people mention not being aware of the enroll counselor. So again, just wanted to make sure everyone was well aware of that. It's kind of tough to do an in-person meeting with how spread out our offices are and, with trying to take care of patients, we know. So that's why the counselors are there. If you have any questions, if you need them to explain the benefits to you, they're happy to do that. And that gives you that one-on-one attention that we want you to have. Everybody has different questions and different needs. So you can get an individual counselor to address any questions or needs that you have and definitely take advantage of that. Again, the contact information is on the instructions page of your open enrollment contact guide, or you can connect to a counselor through the well-connected app. And then one last thing, when Paul was talking about our Wellness Rewards program, it just brought to mind the slide from our Acropolis presentation on retirement planning that shows when it comes to retirement planning and our investments, that there are a lot of items that are outside of our control, but there are also a bucket of items that are inside our control that we can actually take action on. So same thing comes to healthcare costs when we're looking at that. There are a lot of items outside of our control, but there are some items that are inside our control and we can do something about. So one of those is our wellness programs and making sure that we're doing the preventive things to help make sure that we stay as healthy as possible and avoid having those long-term chronic diseases pop up where we're really sick and it's also causing a lot of costs. So definitely look into our Wellness Rewards program, take advantage of that. And if you need any more information about it, just shoot an email to employeewellness@usahealth.com and somebody can get back to you and help you get any information that you might need. Also, after the first of the year, keep an eye on your emails. We'll be putting out some other resources if you're enrolled in the medical plan for some programs that can help you be a more educated healthcare consumer. So a couple that come to mind, we have a partnership with My Drug Cost, and you can take advantage of their platform to find savings on prescription drug costs. So that's another great way to help keep our healthcare costs as low as possible. So we'll do a refresher sometime in January or February to make sure everybody knows about that and can take full advantage of that. Another resource we'll, again, put information about and make sure everybody understands after the first of the year sometime is the Aetna Cost Navigator. So that's available through Aetna.com, and you can actually go online there if you are enrolled in our medical insurance plan to check the cost of procedures or services before you have something done, just so you can make sure to make an informed decision on where you go so that you'll have a quality place of service, but you also aren't paying too much cost for that service. I know recently I used it for checking the cost of an MRI, and it was amazing. Like one place I checked was $3,000. One place I checked was $511. So you can see there's like a huge difference there. And if we can all do our part to make those educated decisions, that can really go a long way to reducing healthcare costs as well and helping control our premium costs. All right, well, just wanted to thank everybody again for taking some time to learn about our open enrollment process this year and the options available to you. If you have any questions, again, please reach out to our benefit counselors, and otherwise have a great day and hope everyone is doing well.